if you are in like 35 and you're saying because of the degenerative changes I have pain in my neck, no, I can't accept that. My whole body is paining. I don't know why. Here also. He will say, oh, because at the time of delivery we have not taken care properly. 90, you're saying more.
Exactly.
So, 90 is too much.
कभी नेक पेन तो कभी बैक पेन, कभी नी पेन तो कभी फुल बॉडी पेन। आखिर ये चक्कर क्या है? हाय, माय नेम इज साहित्य एंड यू आर वाचिंग मोटिवेशनल पिल। क्या चक्कर है और क्या सोल्यूशन है, वो आज हम आपको बताएंगे। तो आज जो हमारे साथ मौजूद है वो एक बहुत ही स्पेशल गेस्ट है, एक बहुत ही स्पेशल व्यक्ति है, वन ऑफ द बेस्ट फिजियोथेरेपिस्ट्स इन बैंगलोर। इनके 2 ब्रांचेस हैं साउथ बैंगलोर में, और इनके पेशेंट्स और क्लाइंट्स के रिव्यूज इतने अच्छे हैं, कितने अच्छे हैं आप खुद ही देख सकते हैं। हमने डिस्क्रिप्शन में इनका लिंक भी दिया है, इनकी क्लिनिक कहाँ पर है और क्या रिव्यूज हैं। बहुत सारे लोगों को इन्होंने नी सर्जरी होने से बचाया है, बैक सर्जरी होने से बचाया है, और ये कम्प्लीटली बिलीव करती कि अगर हम अपने लाइफस्टाइल को ठीक करें, एक्सरसाइज करें, तो अपने जितने भी जॉइंट मसल रिलेटेड प्रॉब्लम्स हैं उनसे हम निवारण पा सकते हैं। जी हाँ, इन्होंने मास्टर्स किया है फिजियोथेरेपी में, स्ट्रोक रिहैबिलिटेशन, फ्रोजन शोल्डर, स्पाइनल कॉर्ड इंजरी, ऑस्टियोपोरोसिस, ये सारी चीजें इनकी फोटे हैं, और ये हेल्प करती है लोगों को कि वो इन सब चीजों से बच सकें। तो विदाउट फर्दर डिले, लेट्स वेलकम none other than one of the best physiotherapists in Bangalore, Dr. Princy. So welcome to the show, Dr. Princy.
Thank you, Sahitya, for the warm welcome.
Pleasure. So हम बात कर रहे थे कि कितना इश्यूज होता है लोगों को बेसिकली रिलेटेड टू देयर जॉइंट हेल्थ। डेली आप पेशेंट्स देखते हैं आप क्लिनिक में, तो सबसे पहले हम जानना चाहेंगे कि ये प्रॉब्लम की शुरुआत कैसे होती है, क्यों किसी को नेक प्रॉब्लम या फिर कोई भी जॉइंट के इश्यूज होने लगते हैं, होता क्या है?
So basically it starts with physical activity relationship with the lifestyle. How active you are in your life. Activity doesn't mean that you're doing your day-to-day life activities like, household work and chores. Doesn't mean that. Physical activity means if God has given us joints, are we using all the joints? Are we using all the muscles?
Why is it said that muscles and joints are made to move? Is it just like that eyes are made to see? The muscles and joints are made to
move. Yeah. So because every joint has bones, 2 bones, right? So God has given that 2 bone to move. Okay. So like for example, shoulder, if you say, I have so many patients coming with frozen shoulder. They are housewives also, they are, like staff workers also. There are many people who belongs to different zones of life, but they all have the same issue. Why? Because we are not using our shoulders to the fullest. The full range of motion of shoulder is this. When you last did it, you must have did it because you belong to the field. But I'm just asking to the people who are watching this, when did you last, move your joint like this and like this, right?
Right.
So when you don't move it properly and to the full ranges, you develop some pain somewhere, your body tends to move it more less. Okay. So that time you will develop more pain. So it's kind of vicious cycle.
When you say pain, what do you mean by pain?
Pain is basically any joint or any area where the lot of waste material is accumulated. It leads to pain.
Okay.
So when we move it, the circulation will improve. Okay, and in that way the pain will definitely go off, and that is why we say physiotherapy can cure the pain, right? Because when person is coming for physiotherapy, you made them do exercises majorly apart from whatever electrotherapy we do. Okay,
right.
So that's why we can tell people that moving the joints is very, very important. Most of the people nowadays have sedentary lifestyle. Okay. And
Right.
people are very, very, very busy, very stressed, but they are not physically active. So the thing is, whosoever you are, you have to exercise in a right manner. Okay, you have to move all your joints, uh, and you have to move all your muscles once in a day.
Okay.
So you need to give time to your body. What happens is, like, when you move your joint, there is a synovial fluid in the joint,
Okay.
right? So when you move this synovial fluid, flow properly inside the joint. So whatever the waste is getting accumulated gets drained off, so that it will lead to no pain. So if you don't want to get pain, move yourself with the normal exercises.
Right.
Go to your any of the person who belongs to the field of exercise, and after getting any condition, you can go definitely to physiotherapist.
So, can we say that, for example, if there's a car and it's right there since 4 years, we're not using it, and that is where the problem starts with the car and the engine, every single thing, because we need to use the car as well so that it keeps on running.
Exactly.
So it's the same thing with
It's
the body.
the same thing with the body. So every machine which is made to move should be moving. So if you don't move your machine, it will definitely need a service, or maybe it will go off.
A lot of people say that, मैं तो कुछ ना कुछ करती हूँ, घर पे पूरे time active रहती हूँ, right? And you mentioned that activity and this exercise is different.
Yes.
Okay, can you describe a little bit about how is it different?
So today we are talking about for general people. So, like, I'm also women. If I say that I work in the kitchen like 2 hours a day, and that 2 hours like hell, every woman has that 2 hours of hell in the morning. Okay, so that is like, standing, doing things, standing, doing things, move, like inside your area only, you are moving. Okay, so you're tired because you have to give whatever requirements of the family, but you're not tired because your heart has pumped a lot. No, you're not tired because of that. Your breath has not reached up because you have exercised a lot. No, you are not fit. You are tired because of the mental stress, or the number of chores you have to complete. Okay, you have to give tiffin, you have to give that and this,
It's
and
like a
etc.
deadline.
Yeah, exactly. You have to complete all that. You have to take care, like they're coming back from the school also, you have to prepare something, that this. So you're tired because of that, but you have not moved all your back properly, all your ankle properly, all your shoulders properly. So
somewhere or the other, you are standing or you are just repeating the
stepping.
same thing.
Exactly, you are stepping here and there. At least better than I would say desktop worker. At least better than.
Right.
But in that also, like if we say, some people have postural issues. Like most of the women have like bulged tummy. Okay, in that bulged tummy, like the pelvis turns occurs. Okay, and if you are like standing with that bulged tummy for long, you'll develop back pain very easily. And what happens is, like, once it will develop, you'll not come to the doctor or any physio or someone. You'll ignore.
Yes.
Then the second step will be, somebody will advise something, then you will do that.
Right.
Third will be, no, this pain is too much now, I have to see someone. Then you will start searching. Like, I'm talking generally.
Absolutely, yeah,
Okay?
that happens here.
So, like that. And then by the time you'll reach your physiotherapist, it will be too much.
It will be like chronic from acute.
Yeah, exactly.
Yeah.
So, if acute pain comes to us, it is not a big deal. Okay, we'll just, give certain electrotherapy which is required, or not required, will not give. And only few exercises will do, and, can cure it permanently if we see any postural sways. Like, for example, the pelvis is turned this way or that way. Somebody will have this kind of posture. Somebody will have, this kind of posture. So all this has created lot of stress points in the body. Okay, so that stress points will be relieved only when we correct that posture and we'll move and strengthen those muscles. But people comes with chronic pain, so that time we have to first cure the pain. Okay, first relieve that pain, and then we will come to the postural things. Okay, now we will strengthen some muscles, we have to correct the postures, like that. So my request to anybody who is having pain, please reach your physiotherapist or to the any concerned medical professionals, whosoever you believe, as early as possible. You can wait for 2 days, there is no problem. But after 2 days, if that pain is not at all going, you just please consult somebody.
Seek a professional help. So to sum it up, so the pain gradually starts off as we do not exercise for a long period of time, and exercise नहीं करने की वजह से blood circulation उस area में रुक जाता है, right?
Yeah, kind of रुक जाता है नहीं बोलेंगे, it is less. Like for example, एक pipe है, right? उसमें से पानी निकलना चाहिए, like if the diameter is like this. So if the water should go like to the hole, we'll say okay, it's working good. But when the water is passing, but not that flow is not there. So what happens? The sides will have some deposits, right? Like that our joint is.
Okay.
So every time that flushing will not come. Okay, so circulation is there, blood is going everywhere, I'm not saying like that. But definitely, like when you exercise, if you see yourself, your face is like flushing,
Yes.
It's totally red. So that is actually draining out. So this is the same concept applies to all the muscles.
So what is draining out? The toxins, or what is that?
What it can be anything, like
the waste
material we can say, or we can say like some people have uric acid issues, some people have different conditions. So we are not here like talking in detail of that.
Yes.
But for the like normal person, why exercise is important? Because you need circulation of the joint, you need that synovial fluid to flow properly inside the joint. You don't need any stiffness to stay there for long. Like for example, people who are exercising daily, like for example, they have been for a vacation for like 10 days. They'll feel like, oh my God, this is not good. I feel like stiff.
Some sort of stiffness.
Some uneasy is there.
Yeah.
Why? Because daily you were flushing that, this synovial fluid was flowing properly, that joint was very healthy. Now, because 10 days you have not moved it properly, so that stiffness you're feeling. Your muscles are not as normal as it was. So like that it is.
Okay.
Yeah. So pain is always not just the because of the stiffness only or because of the circulation. It can be other things also, like there are hormonal pains, there are neurological pains, there are psychological pains.
Right.
So there are many pains, but on like if we are getting like 100 patients, so out of that 100, 80 are because they are not
moving
physically active. Okay, and mostly women are affected in this. Why? Because they are like tied up with all the chores, but they're not able to do anything for themselves. Okay,
Right.
so they are the most ignorant person in the family. Okay, so they are not moving their joints properly, they are not exercising properly, they are overdoing the chores like cooking and all, because they have to take care of everyone in the house.
Yes.
So for them it is more important to exercise.
And exercises also which involves all the joints like neck, shoulder, knee, कर रहे हो. Not just walking and walking. If you're just walking and walking, it's just like there are 10 subjects and you're just reading maths, okay, and leaving the 9 subjects and going for an exam. Or for all the exams, you have just learned the maths thing. You have not gone into the other subjects at all. So it's like being there and just walking, doing only one sort of thing. At that point of time, you have not done something like this. You have not twisted, you have not used all the joints and muscles,
Yeah,
right?
exactly.
So it might be repetitive over about one certain thing and lesser of the
Yes.
other subjects,
And
right?
that creates imbalance of the muscle.
Exactly.
And that leads to imbalance of the muscle, and that is why the pain is chronic. Most of the females have back pain.
Hmm.
And very sad to say that they will say, oh, because at the time of delivery we have not taken care properly, that's why it is there. No, nothing like that. Like giving birth to the child and taking care of that is a natural procedure God has given. Okay, don't blame that for the back pain which you are not taking care of. Okay, so you have to, first you have to be in shape, at least most probable shape which you can.
Right.
First thing. Second is eat properly. Think and eat. Okay.
Okay.
Don't blindly, you are just like a dustbin, you should not eat. Okay. Like whatever is coming to me is I'll eat. Or whatever is there to finish, I'll eat. Like that, if you eat, definitely you will end up with overweight and then pains and then chronic pains and then mental stress and then lot of things.
Right,
Okay.
right.
So this is how the steps goes. You should eat properly.
Fantastic. Let's take this forward. Eating properly, because we are deficient in few things, and because of that also we get joint pain, right? So we'll get into that. But before that, strengthening and stretching. Okay. So there are two things wherein there are tight muscles. The muscles get tight, and the muscles get weak.
Yeah.
Okay. So for the tight muscles, we need to do this, and so if you can talk about that and let our viewers know in layman language.
Okay. So the basically two types of conditions, like as you said, if you have weak muscles, that also lead to pain. If you have tight muscles, that also lead to pain. Okay, so let's take this muscle. Okay, so अगर हम बोलते हैं कि you cannot move this joint up to the full range, so like if I cannot bend this elbow to the full range, what could be full range means पूरा जितना हम जा सकते हैं, जितना मेरा एक नॉर्मल हैंड जाता है, लाइक मेरा राइट हैंड अगर इतना जा रहा है और लेफ्ट नहीं जा रहा है, so we will say it's not full range, or maybe I'll develop some pain because of that. So we'll see कि क्या प्रॉब्लम है. तो क्या यहाँ पर टाइटनेस बहुत ज्यादा है जो कि इसको जाने नहीं दे रहा है, लाइक इज द टाइटनेस सो मच इन द माय ऑपोजिट मसल्स. Okay, so because these fibers cannot pull so much that it let it go here. Okay, so we will say this is tight. Okay, but at the same time, if you give me like 5 kgs, okay, and you say, please ma'am, hold it and lift it, I cannot do that 5 kgs and till here. No, Sahitya, I cannot do this. Okay. So when I say I cannot do this, give me 3. Okay. So I'll try with the 3. So if I'm a new person, maybe 3 will be also difficult. But if you say 1 kg, 1 is like everybody should do it.
Right.
Okay. So if I say 1 kg, I'll lift it. But no, I cannot do this because my muscle is not have that strength to do it. Okay. Could be other conditions, but I have just given an example to explain what is tightness and what is weakness. So like that it goes.
So for every muscle, okay, how I am understanding is for every joint there is a range of motion. Shoulders है यहाँ तक उठना चाहिए, एक डिग्री है, एक लेवल है, ठीक है, नी है, एक्सटेंड होना चाहिए. अगर वो रेंज ऑफ मोशन नहीं जाता है, it can be because of tightness or weakness.
Yeah, and you can always compare one joint to the other of your own body.
Right, and it goes with the neck and shoulder. Let's say neck example. I think कुछ लोग एक साइड टर्न कर पाते हैं इतना और एक साइड completely turn नहीं कर पाते.
Exactly, and they will come with the neck pain. And I have seen neck pain हो रहा है because I have developed spondylitis and this and that. I was like, come on, see this way. Yes, see this way. No, I can't do that completely. Oh, your muscles are tight. No, I have bony conditions, that's why I have pain. No, ma'am, you have your muscles tight, that's why it is stressing you since very, very long and it has lead to pain. I know that, bony conditions are there, but it is all aged ones. Okay, if you are in your, 68 and 65, like that, if you come and say, oh, I have degenerative changes, yes, this pain is because of the degenerative changes. But if you are in like 35 and you're saying because of the degenerative changes I have pain in my neck, no, I can't accept that. Very rarely it can be there, but mostly it is because of your tight muscles, wrong posture, and your, lifestyle and body attitude. Sometimes, certain people have, tendency of putting the neck this way. Subconsciously they are like this.
Yes.
They're always like this. So they'll have this side tight and this side okay, but they'll not realize it. This is very fine things. Only we can, when person will come to us and then we'll assess, oh, you have this way, that way. Okay, this is the condition you have. Ma'am, really? I mean, इतना से दर्द होता है? Yes, होता है. And we have corrected. Oh, yes, it has relieved after some sessions only. So your body is, like a proper structure God has given. If any deviations here and there for long will be there, definitely it will lead to some condition which will be pain or some stiffness or some disease like that. Like for example, let's take back pain only. Certain people who have weak muscles can lead to back pain. Like if you have back extensors weak or sometimes abdominals weak lead to back pain. Okay. And if you have tight hamstrings, like this whole part is very tight, then also it will lead to back pain, and that too very severe. You will not imagine ki, like I have treated patients, they are like, we have gone to orthos, we have gone to this, that, but we have not relieved. Can you please tell me why this back pain is there? We have checked. Okay, please lie down, do this and that. Oh, your hamstrings are tight. Okay, really? But these muscles, how it will lead to this?
Yes.
Oh, your body is connected.
Right.
Okay, so if your body is connected, if one muscle is tight and you're walking, so this is pulling back, right? Because it is very tight. So again, it will lead to pelvis turn, right? So it is overstressing here at this point, and that is why it is leading to pain. And like some 5 sessions of hamstring stretch will lead to relief of that pain. So you need to, go to the right person first,
Right.
to get the cause and then treat that. It is very easy.
So, two major things that there are causes and it is treatable. Okay, so even if you are having any sort of issue, do not ignore that. Make sure that you know the cause of it, because there's always a root cause behind every issue that you're facing. Great, and a lot of insights we have got about all the, how we can. It's in our hands how active we are, or how can we change stuff for ourselves.
Yeah.
And posture is one of those things. Subconsciously or consciously we, and today तो मोबाइल का ज़माना है, लैपटॉप वर्क है, गाड़ी में बैठ के बहुत देर तक जाते हैं, राइट? तो because of the posture issues also we get to see the major pain later on, right? So can you tell us few insights which we can, which should be like, how should we sit? There is something called as ergonomic guidance. What all can we do when we are on the office desk? Minimum thing जो कि हम सब कर सके.
सबसे इम्पोर्टेंट होता है, like when you are working, wherever you are working from home or office, you should be on a workstation. First thing, you should not be on your sofa, should not be on your bed, or you should not be on the floor also. Okay, sometimes people think, oh, ye to hard hai, means we can sit over here and it is very good. No, nothing hard, nothing soft, always firm. Firm is the key. Okay. So you should always be on your station to work. You should be on a table and chair. First thing. Second, whatever your screen is, it should be on your eye level.
Okay.
These 2 things is okay for now. Third is, you should always take health breaks. most of the people have desktop works these days. Even they are not software professionals also. They are related to the sitting and the screens also only. So health breaks. What is health break? Every 2 hourly, one person has to release those muscles which are being stressed for 2 hours. Okay, I am sitting like this. My certain muscles are getting stressed since I am sitting like this. Then what I'll do? I will relieve those muscles by standing up.
So you mean to say, if you're sitting also, our muscles are working? Your
Yeah.
muscles are.
If you're sleeping also, your muscles are working.
Is it? That's interesting. Okay.
Yeah. So to relieve one particular muscle, we have to, just stand up. We just have to move our hands like this. Simple, very simple. Just shrug your shoulder.
Okay.
Okay, so what we have done, itna there say whatever stress was coming here, we have released that.
Right.
Okay, just 3, 4, and just go have a sip of water, talk to somebody, come back,
Yes.
and you are all fine to work again.
Okay, and
It's that easy. But what we think is, Arey, if I'll go, I'll break the continuity. That's definitely there. But your body has to work for long. So you have to think in that way that I have to take that break.
but it has also a good mental effect.
Exactly,
Because
exactly.
after 90 minutes, I think there's a rhythm which stops, So in a meeting also, you cannot stay more than 90 minutes concentrating the same way the way you started.
90, you're saying more.
Exactly.
So, 90 is too much.
Yes. So I think our brain also needs relaxation and our body also, and then we can come back to work in a better way.
Yeah, definitely. And you'll not end up with the pains. So
Right.
definitely your efficiency will be more. Okay. So that way you should take care of your, postures, your working stations, and the health break plays a very vital role in all our patient with neck pain and back pain. So you can't skip your work, right? You can't take break for long. Okay, I'll not come to the office or I'll not work. You have to work, right? And it is a one-day game. No, it is a 1 year game. No, it's a lifelong game, right? You have to do same job for years, 30 years, 40 years. So you just think 40 years, same muscle stress. So what if you take care of that from the very beginning only? Okay, you just take health break. Okay, stand, move your hands like this, move your shoulders like this, just stretch your ankle like this, go have water, talk to somebody, come back, work again. You're all fine to work.
I'm already feeling good when I'm doing this after sitting for so long.
Yeah, exactly. So that's how your muscles, same position, they are, if you move a little, it will get good circulation, and the fibers will be,
Relax.
So that way it feels good also, and it's healthy also.
Great, superb. So now I am sure that the viewers have also understood what's happening with us, with all of us, while we are sitting and we are doing repetitive exercise, and why we need to start exercising. Superb.
Yes, and that's why the exercise plays very important role in everybody's life. Even it is like for the disease condition, or it is a normal person with no condition. And that is why we are celebrating the World Physiotherapy Day, because physiotherapy is like exercise, and exercise plays as important role. So physiotherapist has very important roles in everybody's life nowadays. So happy World Physiotherapy Day to all.
Happy World Physiotherapy Day to each and everyone, and thank you so much for all the learnings throughout the process. One thing that because now you have come, in our show, definitely we would like a little bit more insight about stuff. And one thing is about nutrition, because a lot of people have vitamin D and my vitamin issues, right? They have less of it, and because of that also, even though they are exercising, okay, there are a lot of people who start exercising and then they get pain.
Yeah.
Right. So this particular thing, and how is it connected with the nutrition thing?
So as you have talked about vitamin D, so like this is like almost every third patient is deficient for us. Okay, and if you have pain, you are getting it treated, it's not relieving at all, and you have body dullness, you don't feel to work. Most of the software engineers have that protruded chin. Okay, so because they are working like this always, and I am just 35, why it is paining? Please go to somebody who is the right person, maybe your the physician, maybe your physiotherapist. You can go and they may suggest you to check your vitamins, and vitamin D and B12 playing very important role in curing pains. It is very important, so you have to be in the sun. If you can expose yourself like 10 minutes to 15 minutes a day.
Also, eating is very important, right, for our joints and muscles.
You should eat well. That is the main thing. You should think before you are eating. You should not eat because it is present in the plate and it is being served. Okay, you should think, okay, I am eating this biscuit. Do I have any plan today? By that, I will digest this particular biscuit. Because that biscuit is so small but huge calories.
Yes.
It looks so small. We eat biscuit just because we eat it.
Right.
We don't eat it by hunger, right? So that way, at least that conscious should come to it. And
so basically, you're saying you overeat and all those, indulge into all these things, you gain weight, and though that weight puts pressure on your joint as well.
Exactly. If you are overweight, you are full of pain. You are our patient.
Exactly, and I think I read somewhere that 1 kg of extra weight leads to 4 kg of pressure on our knees.
Exactly.
Is it?
Yeah. So that's same. If you are overweight, you are you are wrong postured and overstressed here and there, so leads to inequilibrium and pain.
Har taraf se issues.
Exactly.
Right?
So weight is the key. So for heart issues, for pains, for anything other, weight should be less. So you are the right person here. Living long.
Well, I need to gain weight, and we all need to do something.
No. Once in our like when I was student, our teacher says, so there is a research going on how we can increase somebody's lifespan. It's a very huge research going. As he said, I don't know. He said that it's a huge research going on, and what they have concluded till now is only the lean person live longer.
Is it?
Yeah, and Sait is going to live long.
I hope we all live long, and we can do that if we actually create a lifestyle for ourselves. Definitely, and thank you so much for this amazing gesture of yours. Thank you for coming to the show and so much of insights. I'm sure there are a lot of takeaways for everyone, and we'll be doing this often. Make sure that you share this with a lot of people around you, because a lot of people are going through these issues. Till then, take care of yourself, and we'll see you in the next video.
Thank you.
Thank you.
So that's we have to adapt the lifestyle where we should exercise daily and choose a right person to exercise also. That's very important. Like for example, just me, I'm saying. So if like you're a traffic police, okay, so you're standing, but knee pain. Why knee pain? I'm walking, but I have knee pain. Because you are not, bending it fully and, straightening it fully daily.
Okay.
But on the top of it, you're stressing it daily. So your muscles doesn't have so much strength to bear that weight. And your joint is not at all moving properly. So there is less of, circulation daily, which has to be taken place.
Particular way. Right? For example, you said walking karte reh jayenge, to fir, you're not using your knee because it is straight, right? You're not bending it.
Yeah.
So wo knee problem, you have to use the joint accordingly.
Yeah.
Right? So how important is, so that's a great point. Now coming back to the posture. Okay, I think we were talking about the posture part. Few things that we can do, you already explained. What was next that we were about to speak?
Okay, so like for like we are talking about software engineers. This. Sometimes they start like this. They will be getting interested, and then they'll end up like this. So this kind of posture they have. Some like it is stressing here a lot.
So automatically you're saying that the posture is like this, okay, because of the habit that we have created.
Exactly.
Okay.
And because of that, it can be a lot of issues. It can be neck pain, it can be arm pain, it can be, wrist pain also. So what we will do, we will just correct that. So if it is out, we have to just go in and, strengthen the back muscle. Like that opposite way we do. And it is very simple and it gives result.
So there are a lot of pointers which are coming here. First is that every muscle is connected somewhere.
Yeah.
Okay, so even if you're having a flat foot, okay, or something like a problem in your ankle, that is connected to the entire body, and it can cause cervical pain also.
Yeah.
In the major conditions, right?
Yeah.
Back pain, hip pain, everything is connected. Same goes with the neck pain, starting off with the hand. That is the one thing that I got to know, right, when I'm speaking to you. The second thing is more about that we are the interesting fact that even we are sitting right now, the muscles are working. There are some muscles that are working and we are overworking those muscles, right? And because of that, वहाँ पे stress पड़ रहा है, right? It is just thinking about one thought, overthinking जैसे होता है, वैसे overstressing your muscles, unknowingly.
Yeah.
So for that particular, that causes an issue and that needs to be treated.
Yeah.
At the end of the
Exactly.
day. Yeah.
Exactly.